to go to a library, you have to get an encyclopedia out to find this information. You've got it all here now. So technology is a real enabler of help. You know, it helps so many areas. It helps so much for learning for kids when they're in school. It helps for adults. It helps make our jobs work well. But obviously, we've got disadvantages that come along at the same time. It's known to affect the attention of adults and for kids as well. And for some kids, when they're learning how to manage their attention, how to keep their attention working on things, it can disrupt that process. As I said before, there's risk of addiction. And these phones, unfortunately, the software that's on there is designed to keep us using it more. It's designed to be addictive. So there's issues there. But for very, very young kids, it affects how they learn how to use their body, particularly their fingers. Kids who are using it at a very young age sometimes don't have the right manual dexterity. And that's already been established in studies that their kids are finding it harder to tie a shoelace or how to hold a pen because they're not developing, they're not holding things in their hand, they're not playing with toys, and they're not playing with things that they would normally build upon their development. It definitely affects sleep. So if you use a device late at night, the blue light from the screen keeps you awake more, so you don't get as good quality sleep. And as we've been talking about myopia, when you're holding something very close to you for a long period of time, it's as a child, it's more likely to make. So some of the advice that I give, taking breaks. That's really, really important. The most important thing is getting away from the screen, and you've got to replace it with something else. There's something called the 20-20-20 rule, which is every 20 minutes, you should look at something 20 feet away or more for at least 20 seconds. And that just gives your eyes a break. You're not focusing at that distance. You know, if you imagine you go for a very long run, your legs will get tired. But if you take a break, relax them, they'll always go back to normal. So it's kind of taking those breaks. Really, we should cut away our devices an hour before going to bed, because then that gives our brain a chance to unwind. Even what you're using on the screen can be quite stimulating as well. So having that time away improves your relaxation before preparing the brain to go to bed. Now, for age groups, we've got to be careful about what age group. So if a child is under 2 or 3, really they should be doing very, very minimal screen time. And some of the advice from a lot of the organisations say that you shouldn't use it at all under those ages. As we go from kind of maybe 4 or 5 years old, a limited amount of screen use can be actually helpful. You know, if it's half an hour a day doing something educational, might actually be better than not using it for those things, because you're actually learning. So you do have to teach kids how to use the devices in a controlled way. And then as they get a bit older, then having a bit more time, but again using it in the right way. But they have to be able to be taught good habits, how to use the device, know when to put it down, when to use it. And if you supplement it with lots of other activities, games, kids playing sport is a really good one. If they're doing a sport outside of school, then that automatically will take them away from the device. It will get them outdoors. It will get them doing things that's physical. It's great for their body. They can be interacting with people, and they can be doing things and building good habits that they can use as an adult. So a lot of, if you're playing badminton or playing any kind of sports as an adult, they can continue and they can keep their body working well as well. So some of the important things to take away from the talk today. So firstly, do make sure that your child has a regular eye test. Children, at least once a year, they should be having a test. Many kids become short-sighted or have other issues. They don't know that they have an issue, because as far as they're concerned, they can see everything okay. As I said before, get outdoors. It's really important. In countries like Norway have a lower rate of short-sightedness. Now, Norway is the weather like it is today, freezing cold, but kids wrap up and they get outside. And the incidence is much, much lower than short-sightedness. Make sure that they have really good habits for the close-up work, for taking breaks, holding books at the right distance. And then if your child does become short-sighted, speak to someone who knows about it, and then we can try and do things to slow down the rate of change. And obviously we've got a whole load of adults in the room here, so you should all be making sure that you have an eye test every 2 years. Some of the important things to look out for when you're short-sighted, as I was saying before, there's a higher risk of having tears and retinal detachments. If ever you see any new floaters, now people know what floaters are. So it's when you see something moving around in your vision. It's normal, about 80–90% of the population have this. But if you suddenly see a new one that you've never seen before, it needs to be investigated same day. So you need to contact someone. If you see a funny shadow or a funny patch in your vision, that also needs to be investigated the same day, or any flashing lights or floaters. And like I said, same with the kids, your own habits for using devices, using close up, you need to look at that, taking breaks, getting away from the phone and doing other things, getting away from the computer as well. So that's the main thing I want to say. Thank you very much, everybody, for listening. We want to do questions now. Or we want to yeah.
I'm going to introduce our case study for today. That is Kaya Maria. She's 13 years old and has been wearing orthocare lenses since the age of 10. She's in year 9 student at London North Collegiate. Yeah.
Hello everyone, my name is Kaya and I'm 13 years old. I began wearing orthocare lenses every night in August 2021 as a way to slow the progression of my nearsightedness. This means that I can see objects that are near clear, but had difficulty seeing objects that are further away. Before starting orthocare lenses, my prescription was increasing at a rapid rate. In August 2021, it was at -2.75 in my right eye and -3.25 in my left eye. My optometrist recommended this treatment as an effective solution. Orthocare involves wearing specially designed rigid gas permeable lenses overnight to gently reshape the cornea, allowing me to have clear vision during the day without glasses or contacts. My early challenges were inserting and removing lenses, as I had never worn lenses before. Learning to handle the lenses was a bit intimidating. It required patience and practice to build confidence. I had a few mishaps where I lost a pair of lenses early on, only to find it was stuck in my pajamas. One lens went down the sink drain, and once I put a chip lens in my eye, which was a bit frightening as I got an infection. With support from my optician and my family, I learned how to handle these situations calmly. I had to develop a consistent nighttime routine to ensure I wore the lenses every night for the best results. There are times when I'm away on a school trip or a night flight and I don't wear my lenses overnight. I get away being able to see for one day, but towards the end of that day, my vision goes a bit blurry. Some people can get away not wearing the orthocare lenses for a couple of nights, but I have only ever skipped one night. Using orthocare lenses has made such a big difference in my life. I can see perfectly during the day without wearing glasses or contacts. This makes everyday activities like school and sports much easier. Swimming has become a much more enjoyable activity of mine, as I can actually see things further than the pool and the ocean. I can wear sunglasses without worrying about prescription lenses. My prescription has stabilized significantly since I started wearing orthocare lenses. My last check showed my right eye was planning, which means no correction is needed, and left eye was -0.50. I visit my optometrist regularly to ensure my eyes are healthy and that the lenses are working as intended. I change my lenses every 6 months. I've learned to properly clean and install my lenses to keep my eyes healthy and avoid infection. It's a daily nighttime routine that I have to follow and clean my lenses. This experience has taught me several important skills and values. Wearing ortho-K lenses requires sticking to a strict routine. I've become more disciplined about taking care of my eyes and lenses. Overcoming initial challenges, like learning how to insert the lenses, taught me to stay calm, be patient, and persistent. I'm now going to give advice for other people considering ortho-K. Don't be afraid of the initial adjustment. It may feel strange or uncomfortable at first, but it gets easier with practice. Make sure you follow your routine. Consistency is key to getting the best results and maintaining clear vision. Ask for help when needed. Don't hesitate to talk to your optometrist if you experience issues like discomfort or if you have questions about lens care. I plan to continue using ortho-K lenses to maintain clear vision and slow myopia progression. I'm grateful for how this treatment has improved my quality of life, and I hope my experience can help others understand the benefits and challenges of ortho-K. Thank you for listening.
Thank you, Kaya. I identify with that thing about using lenses because I've done that many times. And Hanpai, thank you so much for everything that you've shared with everyone here. We're going to open up the floor for questions. So if people have got questions, can you put your hands up and just ask your question of both Pam and Mike? Are you happy to answer questions? Yeah? Okay. Keep the mic.
Hi, I have a couple of questions. One, the ortho-K lenses, has any studies or anything been done with adults to see if something like that will change the eyes?
So for adults, you can use it as a vision correction. It's a bit harder for adults after about 40. Our corneas are a bit less flexible. So it takes a little bit longer for it to take effect. It won't, if you stop wearing them, your vision will go back to normal. So it's just, for adults, it's just an alternative correction.
And for children, do you actually do like eye exercise regimens and stuff
Yeah,
like that?
if they need it, yeah. So as a routine, I would have a look and see. So what we're finding actually, some kids who are short-sighted have their eyes don't focus quite as well. And that could be a factor as to why they become short-sighted or why it's getting worse. So I would normally check that first and then give them exercise if they need.
Okay, can I ask you a question? When did you first realize that you had these issues with your eyes?
So I got glasses when I was in year 4, so 5 years ago, so when I was 8 years old. And my parents don't have glasses, but we thought it was like my dad's sister because her eyesight was like a bit advanced. And I was quite young when I first got glasses, and I was like, my parents were just like following me up. And then because my eyesight number was really like high, and it was like -3, -4, they thought that they'd get it checked. So my optometrist referred me to the opticians I have now, who deal with like the myopia, and they figured that I had myopia and the
So would you say you had the issues because of your parents?
So
anything else that you were doing, or was it just?
it could have, I think it was like my screen time because it was like lockdown when I had like, we were online a lot, like doing my lessons and school, and I think it was just like as said before, like close, like really like close to like your eyes, and like having a phone or like iPad really close to your eyes.
And so, Bobby, before you come in, she's on all these lenses. How long will she carry on with this?
So with lenses, the risk. So when you become short-sighted, you're short-sighted for life, right? So you're going to need some correction.
It's not reversible.
Sorry,
It's not reversible.
you can't go back the other way. No, it only goes one way.
Okay.
But up until about 18 to 21, there's a potential of it getting worse. So up until 18, 21, then it's really important to do some option to try and slow down the rate of change. Depends. 18 depends on what you're doing, particularly at university. If you're going to be a lawyer, you're going to spend a lot of time reading. So lawyers, on average, will progress a bit during university time. Less academic subjects may not change as much. And then after 21, we leave it up to the kids what they want to do. So some kids will continue wearing it because actually it's a really convenient way of correcting the vision.
Right.
Some kids may want to change to other options as well. When they reach 25, they might want laser treatment or some other option like that.
Oh, so there are other treatments.
So you've got after about 25, you've got laser option, which will correct short-sightedness. So then you've got options like that.
Oh, I see. Okay. Sorry, one more question. You recommended that when kids are reading books, they put a bookmark after every few pages.
Yeah.
I find these days there's a lot of reading done on this computer.
Yeah, that's right. So setting timers, there are some apps I think that will set a timer and will warn you or remind you when you've been doing something for a particular time. So I think they have to find other solutions for that.
Right. And your very first slides, you showed the normal eye and the elongated eye.
Yeah.
So is it,
So there's a few factors that actually causes that. So normally for kids, I actually use the measurement of the eyeball length as a way of checking how fast their eyes are changing.
Right.
So what happens is the eye can only grow, right? So what it does when it becomes short-sighted, there seems to be an optical signal. The brain sees, the eye sees that it's out of focus, and it tries to compensate. But all it can do is grow a bit bigger, and then make you more short-sighted. So the peripheral part of your eye, the focus changes on that side when you become short-sighted. So it's that peripheral part of inside the eye that seems to be sending the signal.
Thank you.
You mentioned that for people that are very heavily short-sighted, they're at a bigger risk of coma, cataracts, and so forth.
Yeah.
Do you have any suggestions for what people can do when they're already at risk? And have high, short-sightedness to prevent or to mitigate these, other eye concerns.
So first, you're having regular eye tests.
Sure.
At least every couple of years. Make sure that when they actually do the test, they're able to check the retina as far out as possible. So that's really important because sometimes you can pick things up in the very early stages. And the other thing is just being aware of those signs that I mentioned before. Changing floaters, seeing any of those things.
But anything I can do, like exercises, anything?
There's not really in terms of exercises that will work for that. I think avoid doing
vitamins or
we don't know whether vitamins do help the blood circulation and help the eye itself. We don't know if it's going to reduce the risk of these happening, but there's no harm in having good nutrition. Things that like blueberries, kale, that kind of stuff. Anything with lots of colour to it is very good because that's the pigment that you find inside the eye. That has a very protective effect on the retina. There are some supplements that increase the amount of pigment at the back of the eye, which do reduce the risk of things later on. We don't know if it's going to how much it will reduce some of the myopia changes, but it will reduce some of the changes as well. Avoid bungee jumping or really high impact activities because that could put you at a bit of a risk. But other things, there's nothing else specific that way that reduce the risk in the future.
another question, not directly related to myopia, but in conjunction with it. So when I was a little kid, I had slight myopia, but I have congenital nystagmus.
Right.
It's not severe. You know, I still have 20/40 vision, so it's not bad. It hasn't gotten worse over time, which is a good thing. But you get cases like that, and what do you do?
Contact lenses for nystagmus sometimes dampens the movements. So for some people, they get less movements. We get less people with nystagmus and short-sightedness together. We do have a few. With nystagmus, you're more likely to have a lot of astigmatism or to be long-sighted. And then we have a look at what else is going on there at the same time. So you just kind of need a regular record. That, then it's a bit more risky of a procedure. But all treatment, what they do is they just slow down the rate of change. When you, as an adult, your prescription is not as strong as it would have been otherwise, and you won't have as much eyeball growth. Well, it seems to be better than it used to be. When I was like 25, I think it was riskier. So as you can see, I was still wearing my glasses, but I think if I was 25 now, I'd probably consider it.
Same question about the laser. Children 18 to 21, if it gets worse.
Yeah, so there's a potential of it still getting worse up until about 21.
And laser is one suggestion. How many laser treatments can you have? Is it just once? Or?
It's normally just once. So it's a laser usually once, yeah. Because what happens, normally it needs to be stable for about 2 years before they'll do the laser. So that's why normally they have 25 as a cutoff, making sure that there's no change for those 2 years. And for the laser treatment, they actually have to remove a little thinner layer of the cornea. So, and the more stronger the prescription is, the more of the cornea they have to remove. So if they've only removed a little bit, then it might be a little bit left if they need to do any further correction. But sometimes there might not be enough. So it depends on the individual if there's enough cornea to do another procedure.
Because you suggested 2025, you can get one, and then that's just once. And
it's usually just once, yeah. Yeah, but it may after 10 years, it might drift back again. We don't know.
And then they go back to glasses.
Yeah, then they may go back to glasses. Yeah.
Okay. And what about those lenses, those permanent lenses that are being put now?
The ones for the implant.
Yeah,
I mean, if you have a cataract and you have a cataract operation, then they will put one in automatically, which would correct your vision. If you're very short-sighted, some surgeons might replace the lens and put the implant lens in. It's more risky surgery, but for some of the stronger prescriptions, it may be one of the only things that people do.
Just one more question for Kayla. I've now hidden my iPad for my daughter. She's 11, and now she's on the phone. How do I get her off the phone?
It's a really hard question to answer, in my opinion, because like our generation is like our life is most of it is on our phone, but there are definitely things that you can do. So like set screen time. But also there's a thing if they have an app on the phone, it's called like stream restrainer. So it's on settings. So if you're holding your phone close to your eye, it can it will tell you and it'll just shut your phone off. So you have to move it further away and then it'll be fine. When I first got it, when I did the update, it was really annoying. But I can see how it's gonna affect.
Thank you. I'm still struggling. I don't know what, unless someone tells her, but she doesn't listen.
I don't think any of us will listen. It's been hard because most of our day-to-day life is consisting of on our phone. But yeah,
thank you.
Maybe have a suggestion of outdoor activities.
To take that every night. She has activities, but it's the phone I'm having now the issue. The iPad's gone.
Switch off the internet. You have a your Wi-Fi, put it on a time in the evening after a certain time. You can get these family link or anything where they're connected. So yeah, you can have a family link, which is a Google thing or Apple Assistant, where you can even select which device you want to disconnect.
Excellent. Thank you so much.
Thank you. So thanks a lot. I grown up thinking about myopia, about highly short-sighted, and so reduced recently. Both my kids, they've had it much younger age. I had my son, who's got myopia, we already doing his lenses. Question is, when would we that we just started a year ago? He started off with 2.7. One of the eyes is much higher. Whenever we first checked it, and that's when we realized a few months ago. And then it's regret that when you think the lenses, he's 9 now, and we've considered it, but I don't know whether it's right.
I mean, you talk about having the contact lenses.
Yeah, what Pierre mentioned. I think
I've got the youngest was 5 wearing quite successfully. So as soon as they're ready, even sometimes if they, as long as they can tolerate it, and some kids I might teach them how to tolerate the lenses first a little bit, get them prepared, and then 9 I would expect them to manage it by themselves.
Yeah, and I think yours, I don't know how we recommend it. So I'll make him listen to it. That's a really good story, rather than us coming from someone like Kira.
Yeah.
My daughter, she's actually long-sighted and she's got stigmatism. So she's got the corrective lenses. But is there any other solution for it?
She's got regular contact lenses.
No, she wears it.
Yeah, long-sighted, there isn't anything from that point of view at the moment. Long-sightedness, it's a funny one. It works slightly differently to short-sightedness.
Yeah, and that she's got stigmatism.
Yeah, and then there's stigmatism as well. It's kind of a different profile. She's probably a different person compared to the other.
Yeah,
as well. So sometimes it may have an impact on one or the other. But contact lenses may be an option if she wants to wear. Quite a few kids who are long-sighted astigmatism, and if they're doing sports or physical activities.
So I'm caring mom, and obviously the myopia treatment is available privately, but not by the NHS. But it's such a big thing growing, especially the COVID children, as you say, squeeze that availability. So I'm not sure you can answer this, but is there a reason why it's not available?
It's a good question. There's lots of things going on with the NHS at the moment. Particularly, their main focus is really treating people at the point of need. So that's going to always come before everything else. So this is becomes more of a correction as opposed to a treatment. So it's a treatment as opposed to a correction. So there's some provision towards glasses, which would just be correction for now. Preventative medicine is different in terms of the NHS, and it's very difficult to get things working. There's a problem with diabetes, problem with obesity. All of those things need to be managed at an early stage so that we don't get the problem. So there's so many things it's trying to work on at the same time. And so the problem with myopia management, it takes investment, it takes skill and learning, and there's more costs involved in doing some of those treatment options. And the NHS doesn't know where to put all this budget. Very difficult.
This is the parent where the unit 10 and it has carried on 21.
The important thing to remember is that it's cheaper than not doing it.
Yeah.
So from the way that it will happen to the eyes in the future, if you slow down the rate of change, it will be the best of it.
And if we didn't go down that route, then just I'm trying to get knowledge correctly, the short sighted would have just increased the number. Is there a point where you need to, how far can it go before it
Well, I mean, from a number point of view,
Yes.
from so how old were you? 10, you're about 3, so that would probably be somewhere between 6 and 8, maybe. But
her just for the advantage, it increased very rapidly, very soon. So until the age of 8, quite hard. Yeah, and then suddenly it was like every couple of months.
it's growth, so that's why I always look at the eyeball when I see kids, so I can see what's happening.
Just a question for Kea. How do you manage the lenses when you swim or when you go for a swim?
So one of the main reasons I did this was for swimming. So when I was younger, I couldn't see what I was doing. So now if I was to go swimming after wearing the lenses at night, I'd be able to see everything, and it's completely fine. It doesn't affect the chlorine water, doesn't affect your eyes, even if you're not wearing goggles. It doesn't irritate them at night when you have to put them in. It's completely fine.
So she sleeps with
She only wears the lens at night time. She doesn't wear anything during the day. That's why it's perfect for that.
Sorry, I missed it. Yeah.
So initially, when she did get that little scratch, probably at night, there was some movement, action of transport that we did that followed. That's when we initially realized a slight scratch, and then she put it at night. The next morning, red eyes.
So my question, and it's really around working people and people who spend a lot of time on screens, practically the whole day. And obviously in the workplace, there are regulations or rules that make people take breaks or meant to take breaks. But do you see, or is there any legislation that kind of will make those breaks?
I think it's been very difficult to add legislation for employers. I think every going to be a guideline. Even protective wear, for example, if you work on a building site, the employer has to provide something, but actually the user, it's up to the user to use it, right? So even though the employer does everything they can, the employee has to take responsibility as well. Most of them know that if they're using it for too long, that they should be able to kind of find ways to take breaks. Maybe it might be something to force themselves.
Yeah, in my team, I'm always telling people, go get up.
Don't have a stretch because it's not just the eyes.
It's how you're sitting and what it does.
Posture is more, it's more serious. Actually, some of the things that RSI or head and neck things, eye things on the whole, to get away from it, go back to normal. But some of the things head and neck, actually long term.
Yeah, I was talking to our occupational health team. The guys said I'm going to suggest that we get more standing desks. So you're not sitting, you're not working sitting, but standing. And also it's going to do a training session.
For people get around, take a break.
Because that continuous screen time, they have seen people and their eyes continue.
So sometimes for adults, the eyes don't always deteriorate a huge amount. They can do. But it's all those other things that happen. The eye strain, so a lot of these things you get away from the screen, actually a lot of them will sort themselves out. Eyes go very dry on the screen as well. Drops to dry eyes do make a massive difference. Just to add, make them feel more comfortable, make the vision clear as well. So just those things out.
Just over the counter.
Yeah, over the counter one. There's an ingredient called sodium pyramide. If that's in there, then it tends to work better. But there's lots of different. During the pandemic, I was doing a lot of remote calls, and a lot of the time it was people who had sat on the screen too long. A significant number of people get out more, and then within a few days they'll feel much better.
Thank you.
How long have they been in use for children?
So the original studies for slowing down the rate of change came out before 2010. So we're looking at least 15 years. Yeah. But that's the study when the studies were released, so they were using it for maybe 4 or 5 years before then. So it's at least 20 years for that. The actual technology maybe is around 10, 20 before that. Because they were being used for adults, but they found that a side effect of using them on kids was that it slowed down the rate of change.
Okay. Now, in terms of the actual lens, has there been change within the lens structure, composition, or
the design of the lenses has kind of improved over time. So what it does is, so your cornea, the front surface is a particular shape, and when you put the lens on there, it flattens the shape out. And what happens is the point where it flattens, there's a curvature around the edge. Now that curvature is what slows down the rate of change. It changes things optically. So the way that curvature is where you put the curvature, the size of the curvature, that kind of thing has improved over time with better designs. And also the kind of technology for mapping the front surface of the cornea has improved a lot. So that if you get a really good kind of map the front surface, then you can get better correction.
These customized?
Yeah, they have to customize each. That's why you need to read the shape of the eye, and then you need to know within a few microns exactly how much pressure to put on.
Just to add, the natural lenses, actually small holes in there kind of when you look at it, and they give some kind of a guarantee that your number will not
increase, right?
Yeah, if it changes by a certain amount, then they'll replace the lens free of charge.
So it's dated.
Yeah, so I think you can see a little tiny little lens there. So you get a clear bit in the middle, and this bit around the edge is what gives you the optical effect. And then that slows down the rate of change. Those little. This is my small lens. It's got a very similar kind of design.
Anybody else?
Any questions?
Is there any particular color therapy or anything which can help? Like color therapy or something?
Yes, possibly. So there's one treatment with red lights. Now the problem is the treatment that they're doing at the moment involves using a laser. In China, they've had loads of studies, and it seems to have slowed down the change. But there've been a few odd cases where some kids have had damage to their eyes because of the laser. So they're still testing out whether or not it would be worthwhile doing it as a population. There was another study that came out that said that blue light and violet light might do something as well. So what it means really be get outdoors because you get all the lights.
I think in India they say the green color is probably the best.
Okay,
color to look
it might do something. Each color does have some kind of property that it does differently, and it does differently because I do some other color therapies for different things. So there's probably some benefit to some people depending on what they are. Some different things do different colors do different things.
Thank you.
Thank you very much, everyone. So we'll take one more final question if anyone's got any. Okay, sure.
No, just a comment. Just a comment. For me, what works is, I take a look at my wife
Right. So thank you both very, very much. So thank you so much for sharing all the insights today about myopia. And I just want to say a quick apology because we had a bit of a technical difficulty at the start of this. So we weren't able to live stream. But everyone that's watching us on live stream, we have recorded the full event and it will be circulated. A link will be circulated. So you'll be able to watch it all over again. Kaya, thank you. It's not easy standing here in front of everyone and telling your story, so you did it really well. Thank you for that. And I particularly liked your rules. I think they're really good. So who was it that asked about rules? So I'm sure that will be probably helpful. I will thank Bunsi and Meho for doing all of the tech today. And of course, for volunteering Kaya for being our case study. It has been a really good subject for us to explore. Next month's subject is also another good one and one that we don't really talk about in our community, but it's about eating disorders. And we're going to have a lady called Rina Gudka, MBE, who's going to be coming to talk to us about her experience and how she's overcome it to come out of this cycle of the disorder that she had. And hopefully we've got a couple of case studies as well. And that will be on the 18th of December. So we look forward to seeing all of you again and many more people. This evening, it is cold, so I thank you for making the effort and still turning up, wrapping up warm. And yes, thank you very much. Thank you again, everyone. Thank you to you, Brian, and Kaya, especially thank you to you.
हरिहंत प्रभु ना दर्शन करता ओम नमो हरिहंताणम सिद्ध प्रभु ना दर्शन करता ओम नमो सिद्धाणम आचार्यों ने वंदन करता ओम नमो आयर्याणम उपाध्याय ने वंदन करता ओम नमो उपाध्यायाणम सर्व साधु ने वंदन करता नमो लोए सब साहुणम सम्यक दर्शन मुझने मर्जो देशो पंचन मुक्तारो सम्यक ज्ञान मुझने मर्जो सर्व पाप परासनो सम्यक